Hi, everyone. Welcome to our talk named PACIO Project and Interoperable Transitions of Care. My name is Sean Mahoney with MITRE. With me is Nancy Lush from Patient-Centric Solutions. Here's our agenda. We're going to discuss what post-acute care is, for those of you who might be unfamiliar with it. We are going to introduce us as PACIO Project, discuss some of the assessments that are used in post-acute care. We're going to review the use case that we developed with the electronic long-term services and supports folks, give you some highlights from the Connectathon back in May, and tell you what our next steps are, and hopefully answer a few questions at the end. So why is post-acute care important? Well, approximately 33,000 providers in the US care for almost 7 million beneficiaries every year, which cost over $73 billion. More importantly, from a patient perspective, 45% of folks that go to a hospital wind up in some post-acute care services or facilities. And many of those folks wind up in multiple post-acute care facilities, as you can see from this tree graph. So that is why we created the PACIO project. We seek to establish a framework using FHIR implementation guides to facilitate the transfer of health information exchange through these post-acute care settings using APIs. So here's our participants list. You can see we have a mix of our federal partners as well as private industry, both small startups and large EHR vendors. And post-acute care patients have complex situations. So as I've mentioned, many of them go to multiple care settings. Many of them also have multiple comorbidities. So that results in potential points of failure during all these transitions of care. Poor communication is a big risk where, for example, critical drugs and medications are omitted from one care setting to the next. Also redundant information being sent. Collected. And if any of you had seen Morgan Gleason's talk yesterday, sharing her experience of 12 doctors and 23 portals, she expressed it better than I've heard before about the frustration of dealing with multiple forms that you had to fill out, the same forms at each care setting, and answer the same questions. And post-acute care patients have similar experiences, and many of them are not able to articulate and share their care history as well as Morgan is. So reliance on patient care, recall during post-acute care is very unreliable. So in 2014, the IMPACT Act was passed, which was focused on post-acute care. And one of the things that CMS stood up as a result of the IMPACT Act is called the Data Element Library. And that is a repository of all the post-acute care assessments that providers are required to complete and submit at different intervals during a care, admission, discharge, and different time points in between. Each care setting has slightly different assessments that need to be filled out. So one of the first things that PACIO did was create an implementation guide to expose and through an API, the latest version of each post-acute care assessment to any post-acute care facility that needed to complete these assessments. Another early action that PACIO did was to reach out and collaborate with the ELTSS folks whose focus on care plan and goals is a critical aspect of post-acute care. So with ELTSS, we developed this use case diagram, which broke down a single patient's experience from going from home to a hospital to post-acute care and back home. That patient's name is Betsy Johnson, and we'll walk through each one of these scenes to give you a little bit more detail about the complexity of just a single patient's experience in post-acute care and how our FHIR implementation guides were able to enable the transfer of her care from each setting. So this is a systems diagram, kind of a notional diagram, but really represented the number of systems that are involved in the collection and sharing of Betsy Johnson's experience with the fall and through her post-acute care. And each implementation guide that plays a part in collecting and sharing the data, as well as, if you look in the middle, the health data manager, kind of a data hub where each care setting is able to send the information collected from Betsy Johnson to the health data manager, which can then share that to any downstream care settings. And down at the bottom is, as I mentioned, the CMS data element library, where the implementation guide, the FHIR implementation guide that we developed enables an API that any care setting can query and get the latest CMS assessments. So scene one is at home, where Ms. Johnson is receiving home-based services. There's a social worker who visits her and documents her care plan and goals. That is all used in ELTSS implementation guide to then push that captured health data to the data hub, to the health data manager. Scene two is where Betsy unfortunately experiences a fall at home and is admitted to the hospital for surgery. So after surgery, Betsy is going to need additional therapy and speech, language pathology therapists. So they are going to discharge her from the hospital and admit her to a skilled nursing facility. While she's at the hospital, there are assessments completed where cognitive and functional status is collected in the hospital EHR and pushed to the data hub. This is also using the structured data capture to capture the post-acute care assessments as questionnaire responses, which then translate to the PACIO functional and cognitive implementation guides to be sent to the data hub. So scene three is Betsy at the skilled nursing facility. She's receiving therapy for 14 days. So the skilled nursing facility is now able to retrieve all the ELTSS data that was collected while she was at home, as well as the assessment data that was collected at the hospital. This is all pulled from the data manager, which now informs her care at the skilled nursing facility. Betsy also received functional and cognitive status assessments while at the skilled nursing facility, which is also pushed to the data hub. Scene four really highlights the CMS data element library, where the skilled nursing facility is able to pull the latest assessment data from the data element library. And really dynamically present a form to the clinician performing the assessments, which provides every question as well as what the valid responses are, so that the EHR can capture that CMS assessment. Scene five is Betsy ready for discharge, going back home, and home health agency coordinator is now reviewing Betsy's data collected from both the hospital, previous home care, as well as the skilled nursing facility, all part of the triage process.
So hello. As Sean has just explained, we demonstrated that our patient Betsy was moving from facility to facility during an episode of care. She has multiple chronic conditions, and it's critical that each care provider has complete, accurate information at the point of care. But we also need to keep Betsy and her family engaged in her care and informed of her current status. At any point in her journey, Betsy can access the current copy of her clinical data. This helps Betsy engage in her care, provides any answers or details that she may have missed during her discharge meetings, and provides the opportunity to formulate any questions she may have. Betsy also has a son, an adult son, Charles, who is involved in providing support to his mother. Both Betsy and Charles want to be updated in the patient's current medical status. So in this slide, we see that the patient share system includes the ability for Betsy to easily share her medical record with users of her choice. Betsy has created an electronic consent which allows her son to have full access. This allows her son Charles to log in as himself and have secure access to Betsy's most current medical data at any point in time. Patient share is based on user-managed access and the HART standard to enable secure, seamless data exchange. Next slide, please. Data is often either not available or fragmented when a person transitions between healthcare settings. The Patient Share Data Hub that we demonstrated at the Connectathon is a read-write FHIR API endpoint. At the start of our scenario, Betsy's current medical status is written to the Data Hub. As she transitions through each point of care, her most complete medical record can be reviewed by each care provider. At each point, our clinician can update her medical record to reflect any changes or additions. This demonstrates the patient record traveling with the patient so that the most complete current medical record is always available where the patient is receiving care. Our Connectathon track also demonstrated the FHIR API used in a read-write use case, enabling dynamic seamless data exchange across care providers. This will enable better care for our patient with multiple chronic issues. At the same time, this will reduce provider burden in sharing data while engaging the patient and their family in improving the patient's health. Next slide.
So those 6 scenes are what we walked through with participants at the HL7 Virtual Connectathon back in May. It went very well. We had over 60 participants to attend the track. And as Nancy and I just walked through, we were able to integrate multiple implementation guides developed by different independent organizations into a single interoperable use case, which is a little different than what we've seen before, where demos under a single umbrella organization like DaVinci. This was a little different in that a lot of what we did at the Connectathon, we did with not a lot of collaboration beforehand, not a lot of testing beforehand. So it was done live, if you will, which really provided a testament to the interoperability of our multiple implementation guides. Our implementation guides support both the reading and writing of data. So as Nancy mentioned in the previous slide, the data can travel with the patient as they receive the care. And we showed comprehensive data exchange across the continuum of care. So other results from our Connectathon, we were able to retrieve both patient-centric solutions, and MITRE's clients were able to retrieve PACIO and ELTSS data from the Alterum server, the Health Data Manager, and other tracks, Coordinated Care Track, leveraged PACIO data and really an expanded use case to conduct social risk screenings, e-referrals, functional assessments, as well as exchanging functional and cognitive status. And finally, the clinical reasoning track was able to take the PACIO data and calculate an ECQM, the dementia 149V9 for cognitive assessment. So that really demonstrated the analytical potential of the PACIO data that's collected. So what's next for PACIO? Well, we are going to ballot in September of 2020 for our cognitive and functional status implementation guides. And we're also looking for more opportunities to collaborate for future Connectathons. We want more participation from vendors. You probably saw in some of our screenshots from some of the scenes, we have reference implementations to kind of replicate a full EHR. We want to replace those with real vendor systems, real EHR vendors. And we want to extend our use case to add more interoperability. So if you're interested in either adding to a scene or creating a new scene for Betsy Johnson, please reach out to us at PACIOproject.org. And that's it for our presentation. Thank you everyone for listening.